The frankincense benefit, I want to make it easy. When inflammation is the reason of the disease, you can always use the frankincense, because frankincense have the effectivity to influence the immune system, and there especially there are influences in inflammatory regulations. And frankincense, the substances in there, such as boswellia acids, can influence this immune system in a way that the inflammation decrease very rapid and very effective. The dosage is really a little tricky, because it depends how big is the problem. We have here some reports from doctors, and then they make a separation. So when the problem is very, very high, then you need more. The normal dosage, the average dosage, is so about 1,200 milligram frankincense per day. But again, when the problem is is big, then you need so an increase to up 7 gram, so 7,000 milligram per day. This is the absolute upper level, and from this level or from this range, yes, you can dosage individual to the problem. Additional, I want only to point out, 1,200 milligram is effective when you use it every day, because then you have an increase of concentration in the body. That's a very important point, because nothing might make sense when there are a lot of side effects. Frankincense therefore has a big advantage, because the doctors needs a helpful alternative to the chemistry side. And as you know, the chemistry medicine is combined with a lot of side effects. Frankincense is therefore a very good way, because effective, yeah, against the inflammation, but without side effects, and this is reported from the literature. In practice, we can maybe see a side effect of the gastrointestinal system, but this is lowered when you eat something to the dosage of the frankincense. Frankincense is ideal for people with chronic inflammation, and therefore the advice is to take it every day for long-term distance. It makes not sense when you use frankincense only short-term, because then the effect is vanished. And these people are special because it's again chronic, the inflammation is every day, and then you have to lower it with a long-term dosage. On the universities, the professors researched out the contents of the frankincense, and the result is very interesting, because as we know, frankincense is coming from various countries, such as in India or in Africa and so on. And the result shows that the composition is different. This was one result, but more important is that the different combination is aligned to a different effectivity. And in one very good report from the German University in Jena, the professor published the African frankincense is very special, 10 times higher in effectivity in comparison of the others. And this is the reason why when you want the best quality of frankincense, then you have to use the African frankincense. Cancer and frankincense. An interesting objective. First, I explained that frankincense, the contents, boswellia acid, for example, can lower inflammation in the immune system regulation. And we know from the pharmaceutic side that the development of tumor cells, this is from the original point coming from the immune system, and therefore frankincense have a benefit, because when you can strengthen the immune system and protect cells, then therefore you have an advantage against the cancer development. This is a prophylaxis system, but frankincense shows also an effective when the cancer is active. When the cancer is active, then you have to destroy or to prevent the development of these tumoric cells. And frankincense can have an influence of this regulation. Therefore, frankincense, in summary, can give a benefit in prophylaxis of the cancer and also when the cancer is active. When a patient has a problem, of course, everybody wants to have an effectivity at once. In frankincense dosage or in the treatment, you have to say it needs a longer time, because one disadvantage of the frankincense substances is it's going very slowly in the body. And therefore, when the inflammation is very high, first you have to dose very high, but also to say it needs about 8 weeks, 2 months or 3 months. It depends how big the inflammation in your body. When the inflammation is lower, then you can have a success also very fast when the dosage is high. And when the dosage is also high, but the inflammation is very big, then you need longer time. This is a very important information for the customer. And additional, the second very big or important information is to eat a fat food, because all substances are coming better, is a better income in the body in combination with a fatty food. My recommendation is to take frankincense for a longer time. Yes? And I give also the information to my customer. Frankincense effectivity is not so fast, so like aspirin or so something else. You have to take longer, but then it's very effective. So maybe after 2 months, or when the inflammation is higher, then you need longer time. Additional, I want to give information coming from doctors and clinical experience. When you summarize all results, we can say frankincense is always effective. But when it is not effective, normally the customer make mistakes. 3 mistakes are there. First, the dosage is wrong. As I explained, it is dependent how big is the inflammation. Second, the duration, take it longer, not only days, better weeks or months. And the third point, add the dosage or the intake with food, because then the increase of the effective substance is higher. So the result shows 5 times higher, more substances in the body when you eat something. These 3 points are absolutely important.